Hello, guys. Welcome to NepClinic's first ever podcast, episode number 1. And I'm here with Vinayak right here, partner at NepClinic, and Miss Kamakshya Shah, Dr. Kamakshya Shah from Norvic Hospital. She's a consultant endocrinologist at Norvic. Welcome, ma'am. Welcome to our show.
Thank you so much.
It's a pleasure to have you at our studio. Thank you so much for हजुरले चाहिँ यति आफ्नो समयबाट हामीलाई few minutes हामीलाई दिनुभएकोमा. So let's just dive right into it. Ma'am is a diabetes expert. She's been dealing with multiple patients that have gone through diabetes. हुन्छ नि उहाँहरू dealing with issues related to other endocrinological issues. So we'll just be diving on such topics where we'll be talking about certain things. Vinayak, would you like to?
So basically, we'll be talking about diabetes, how it's taken in the society, and how we can help people know what diabetes actually is, and maybe help them prevent it, and help our doctors treat it better.
So, starting off, let's also ask our doctor, उहाँहरू चाहिँ endocrinology-मा कसरी उहाँहरू पुग्नुभयो, or just in case everybody goes through a phase, हामीहरूको MBBS through, but they start pursuing a career. How did Kamakshya ma'am actually dive into this career, ma'am? Could you please give us your short introduction and also like take us through how is it like working as an endocrinologist?
Well, I'm Dr. Kamakshya Shah, and I'm working as an endocrinologist at Norvic International Hospital since 3 years. So actually, I grew up in diabetics family. You know, most of the family members are diabetes, and even my father was a diabetes. I grew up watching him taking insulins and all. So when I finished my MBBS, at that time there were very few endocrinologists available. So at that time, I decided that I will definitely pursue my career as an endocrinologist. So that's how I became an endocrinologist.
That is such a personal story right there. I know.
That shows the passion you have
for the study itself.
Yeah, so like, because, in diabetes, medicine only doesn't work. Because what I saw is the counseling, education is very important for diabetic patient. Because none of the medicine will work until and unless you take care of your lifestyle. So that's why I was interested in this field.
Yes, it's just more than just treating patients with medicine. It's so much more. You can have a personal connection, right, ma'am?
Diving right into it, ma'am, when हामीहरूले ठ्याक्क भन्नुभयो कि यो औषधले मात्रै नहुन सक्ने हुन्छ नि डायबिटिज भनेको त्यस्तो रोग हो हामीले यसलाई इन जनरल भन्नुपर्दाखेरि नेपालीहरूमाझ हामीले चाहिँ सुन्ने गर्दाखेरि चिनी रोग सुगर रोग हैन कि यो साँच्चीकै हामीले जति पेट नेम्सहरू यो रोगलाई दिएको छौँ डायबिटिजलाई जुन चाहिँ हाम्रो एक्चुअली साइन्टिफिकली सेइङ इट्स टाइप 2 diabetes mellitus, right? So are these pet names quite relevant? Do they misguide people in such a way that हुन्छ नि चिनी खायो भने हुन्छ नि सुगर बढ्ने हाई सुगर डायट भयो भने सुगर बढ्ने यो किन हामीले कताबाट पेट नेम्सहरू दिन थाल्यौँ वा त्यसको बारेमा के भन्न चाहनुहुन्छ if people are misguided towards this disease itself?
Okay, so diabetes भनेको अब हामी कमन पपुलेसनहरूले चिनी रोग भनेर नै बुझिन्छ. तर यो रोग लागिसकेपछि यो रोग लाग्न दिनलाई र यो रोग लागिसकेपछि यसको कम्प्लिकेसन्सहरुसँग कसरी बच्ने त्यो उहाँहरूले बुझ्न पर्यो के जे नाम उहाँले डायबिटिजलाई चिनी रोग भन्नुहोस् या जेसुकै भन्नुहोस् तर यो डिजिजसँग बच्नलाई र कम्प्लिकेसन्सहरुसँग बच्नलाई चाहिँ नि के गर्न पर्यो उहाँहरूले नै बुझ्न पर्छ के मेन हजुर सो
हजुर अनि धेरै जस्तो मान्छेहरूले चाहिँ के सोच्छ भने अब डायबिटिज म दुब्लो पातलो छु मलाई डायबिटिज हुन सक्दैन भन्ने छ
वा म धेरै मोटो छु I'm very fat, I'm more likely to be हुन्छ नि diabetic.
Yes, that is true to a notion, but even thin people what they think is मलाई डायबिटिज हुनै सक्दैन मलाई कसरी डायबिटिज भयो डाक्टर गल्ती होला भन्ने एउटा सोच छ नि यसबारे चाहिँ के भन्न चाहनुहुन्छ?
That's very wrong. एउटा biggest misconception डायबिटिजमा यही छ कि हाम्रो पपुलेसनमा मोटो मान्छेलाई मात्र डायबिटिज लाग्ने दुब्लो पातलो मान्छेलाई डायबिटिज नलाग्ने माछा मासु खाने मान्छेलाई डायबिटिज लाग्ने हैन भेजिटेरियनहरूलाई नलाग्ने भनेको एउटा बिग मिसकन्सेप्सन छ है
हजुर।
अन्डरवेट पेसेन्टहरू मान्छेहरूलाई पनि तपाईँको डायबिटिज लाग्न सक्छ
हजुर।
है मोटो मान्छेलाई त लाग्ने नै भइहाल्यो है तर दुब्लो पातलो माछा मासु नखाने मान्छेहरूलाई पनि भेजिटेरियन्सहरूलाई पनि डायबिटिज हुनसक्छ
हजुर म्याम यस भेरी वेल अग्रिड अनि अर्को नोसन लाइक द्याट गोज अराउन्ड इज लाइक बुढो भएपछि डायबिटिज लाग्छ तर वी सी अ लट अफ चिल्ड्रेन विथ डायबिटिज एन्ड दे गो अन्डर डायग्नोस्ड अनलेस दे कम टु अ मोर सिभियर स्टेट सो हाउ वाट वुड यु
सो एक्चुली लाइक 20-25 इयर्स ब्याक है अब डायबिटिजको मेन कारण जेनेटिक भनेको वंशाणुगत भनेर भन्थ्यो
हजुर।
है फर्स्ट मेन कज अफ डायबिटिज वाज जेनेटिक कज है तर अहिले चाहिँ नि तपाईँको मेन कज अफ डायबिटिज इज तपाईँको लाइफस्टाइल
True.
है इभन 18 इयर्स पेसेन्टलाई पनि टाइप 2 डायबिटिज देखिन सक्छ है अब अर्को कुरा तपाईँको लाइक सुगर्स जति हाई भए पनि जस्तो 300 सुगर्स भए पनि पेसेन्टहरूलाई कुनै पनि सिम्टम्सहरू नदेखिन सक्छ 50% पेसेन्ट आर एसिम्टोमेटिक है सो लाइक कुनै अरू कारणले सानो घाउहरू हिल नभएको कारणले या पेट दुख्यो कारणले आँखा धमिलो भएको कारणले उहाँहरू हस्पिटल गएको हुनसक्छ र हामीले जब टेस्ट स्क्रिनिङ गर्दाखेरि चाहिँ नि डायबिटिज 300-400 हामीले देख्छौँ
The stats speak for themselves. It's amazing how मान्छेहरूलाई यसको बारेमा त्यति जानकारी नै छैन कि हुन्छ नि म 18 वर्ष भए तापनि मलाई टाइप 2 डायबिटिज जस्तो पनि हुनसक्छ भनेर म्याम वाट डु यु थिङ्क इन लाइक साउथ एसियन कन्टेक्स्ट वा नेपाली कन्टेक्स्टमा चाहिँ why is it so relevant for people to not have any knowledge towards this? Like, they would be really surprised. As of now, I'm such a young guy, or like Vinayak right here, who exercises so much, but it is possible that if we got a screening done, we might be pre-diabetic. But किन त्यति चाहिँ नलेज नभएको होला त नेपालमा चाहिँ वा हाम्रो यो कन्टेक्चुअली भन्दाखेरि हाम्रो समाजमा चाहिँ why do you think people are so ignorant towards this disease?
अब एक त ल्याक अफ एजुकेसन
हजुर।
है र अब हामी न्यू जेनेरेसनले नै जति हुन्छ त्यति डायबिटिजको बारेमा अवेर गराउनुपर्छ
हजुर।
होइन अब लाइक अब अहिलेको जेनेरेसन डेफिनेटली दे आर लाइक गेटिङ टु हुन्छ नि तपाईँको स्क्रिनिङको लागि एभ्री इयर दे आर कमिङ अहिलेको न्यू जेनेरेसन्स यङ जेनेरेसन्सहरू है तर सो मेनी पिपल आर स्टिल इग्नोरेन्ट के बिकज समटाइम्स इभन योर लाइफस्टाइल इज भेरी गुड लाइक you're taking care of your food, you're taking care of your exercise, but there is another risk factor that is stress.
True. Yes, ma'am.
You know, even though you take care of your food, even though you take care of exercise, but if you have work stress or your personal stress, that can also bring you diabetes.
This is a big factor that doesn't like come into हुन्छ नि when you're talking about diabetes अनि ठ्याक्क कसैले चाहिँ स्ट्रेसले गर्दा पनि हुन्छ है भनेर चाहिँ
so that's how like most of the like people as they're ignorant because I'm taking my food regularly, I'm eating healthy diet, I'm exercising 30 to 45 minutes a day. They're like they're not हुन्छ नि they don't know that they are having like
yes,
stress.
That shows the importance of screening and regular checkups.
Yes.
So we at NepClinic also promote screening tests for diabetes. We think that it's better to be screened early as a pre-diabetic, as you know, pre-diabetic. When you're screened at pre-diabetes, it's easier to manage the diabetes.
And moreover, it's not expensive at all.
True.
The screening, diabetic screening is not expensive.
People have really kind of notion कि a lot of health packages वा हुन्छ नि हस्पिटल्सहरूले प्रोभाइड गर्नुहुने वा डक्टर इन जनरली नै कुनै डायग्नोस्टिक टेस्ट लेखिदिनु भयो भन्दाखेरि what is the relevance to it? It's kind of expensive, but as ma'am said, it's not as expensive. So like sugar screening around, it is actually quite cheap. So we really encourage people to actually go and look up the prices at NepClinic itself. But ma'am, what do you think is the good notion? Like somebody who would think, right, as of now watching the podcast would think, hey, okay, then I might get a screening then. Is it like okay to just stand up someday and just go to hospital setting and screening garaunu cha bhandakiri? Is it okay? Is it like
you can just go to the reception and ask them.
True.
Yeah, just I want to just check my sugar level. So you can just do your random sugar level or fasting. If you're at fasting state, you can do your fasting state, sugar level. Anytime you can check your sugars. You don't need to visit a doctor to get your sugars checked.
Very, very, very true. About when we were talking about the diet, Vinay, could you please ask ma'am if there was, we were talking about, see, like, we regulate our exercise, we regulate
Yes,
the
ma'am.
diet we have.
A lot of people, as a doctor, you yourself, you recommend patients with हामीले सुने अनुसार डायट राम्रोसँग खाऊ एक्सर्साइज राम्रोसँग गर भनेर could you detail more on what kind of exercises and what kind of diets a diabetic should have?
Because I personally feel when people think of diet, they automatically think, "ए भात चाहिँ
नखाऊ."
डरलाग्दो हो, भात नखाऊ."
Yes.
हुन्छ नि, cut out all the carbohydrates in my food.
Yeah.
हुन्छ नि, maybe increase my protein intake, maybe my fiber intake. But at times when we see कतिपय as studies suggest, हुन्छ नि, high fat dietमा, high protein dietमा गयो भने कतिजनाको सुनिन्छ, like even my parents as of now are very scared of high protein diet, but किनभने किडनीमा केही छोला कि केही देख्ला कि यसको बारेमा can you just tell us about like the dietary habits, or what exactly is the good dietary habit when you are like type 2 diabetic?
So, like I said before, like medicine will not only work, you have to take care of your lifestyle. That is diet, exercise, and stress, right?
Yes.
So, diet is like, I'm talking now. Why I'm talking? How I'm talking? Because of the energy I'm talking. From where do we get the energy? From food, right? So, food is very, very important
True.
part of our life,
Exactly.
right? So, you need 35% of carbohydrate per day. Carbohydrate is the main fuel of our body,
Yes, ma'am.
right? So protein 15%, okay, and fat also you can take 15%. Okay, so whatever nature has given, you know, nature has given us rice, potato, fruits, right? In fruits also, like people are so scared to take mangoes.
Yes, exactly.
Bananas, mangoes.
Bananas, mangoes, because it's sweet, right? But it contains natural sweet, whatever, it is beneficial. That sweet, that sugar is beneficial to our body,
Yes, ma'am.
right? It doesn't contain the refined sugars, what is there in Coke and Fanta, or in like packaged juice.
True.
So it contains natural fructose sugar, which is beneficial to our body. So like in mango season, what I tell my patient every time, you can take one mango a day, whatever you want to take. Like, you know, even if you want to take one orange a day, okay? But अब कसैलाई मलाई चारवटा आँप नखाइकन मलाई मनै भर्दैन त भन्नु भएन.
मिलेन. You can't.
So like disciplined manner मा खानु पर्यो भनेको. जस्तो like for example, the Shishirji, you drive or you ride a bike, right? अब तपाईले डिसिप्लिनमा तपाईले बाइक चलाउनु भएन भने के हुन्छ? एक्सिडेन्ट हुन्छ. तर एक्सिडेन्ट हुन्छ भन्दैमा त तपाईले बाइक नचलाउने हैन, राइट? सो रोग लाग्छ भन्दैमा तपाईले खाना नखाने त हैन, डिसिप्लिन्ड वेमा खानु पर्यो, हैन? सो द्याट्स द थिङ. सो राइस पनि तपाईले खाने, एनी राइस, तपाईले जुनसुकै राइस होस्, बोइल्ड राइस होस्, ब्राउन राइस होस्, व्हाइट राइस होस्, तपाईले 100 to 150 grams खाने, नट मोर देन द्याट. अब पोटेटोजहरू पनि नखानु हो नि, हैन? तपाईले आई निड फ्रेन्च फ्राइज, आई निड 20 pieces पर डे भनेर त भएन. 2-3 pieces पर डे, हैन? सच लाइक न्युट्रिसियस फुड हो यो पोटेटोज भनेको पनि, हैन? सो लाइक अ फ्रुट, एनी फ्रुट यु क्यान टेक, हैन? तपाईले लाइक मिल्क खाने, whatever is nutritious to your, whatever is nutritious food, you can take any food. तर यो फ्याक्ट्रीमा बनाएको जुन प्याकेटेड फुडहरू हुन्छ, that is harmful, that is hazardous to your body.
Yes, people should understand that. People have a very bad notion. Especially, I remember once my aunt, so she got diagnosed with type 2 diabetes. And when she got diagnosed, she had this notion that म अब खानु हुँदैन, मैले के खानै हुँदैन, म औषधि चाहिँ लिन्छु तर म खाना खाँदिनँ. And she ended up with hypoglycemia.
And another thing is, अब पहिला अब रोग देख्ने बित्तिकै मान्छेहरू के गर्छ भने अब म खाना छोडिदिन्छु, अब म चामल खान्न, मासु खान्न, यो खान्न, त्यो खान्न भने what's the use? Because you already got sugar in your blood and it will remain throughout your life. You cannot cure sugar, you can only control it. यो कुरा बुझ्नु पर्यो कि. सो कन्ट्रोल अब कसरी लागिसक्यो, अब कन्ट्रोल कसरी गर्ने त्योतिर लाग्ने हो कि. खाना छोडेर तपाईको द्याट इज नट द सल्युसन.
This is what my father this morning asked. He's also diabetic. So I'm actually going to interview a diabetes expert today. Do you have to ask her something? And then he said, like, ask her something. कि कुनै यस्तो औषधि छैन अब चाहिँ हुन्छ नि एउटा खाने बित्तिकै निको होस् भनेर अनि लाइक हुन्छ नि द रिसर्च what's new in the world of diabetes, and I told him okay, I will ask her but no promises on the answer.
So that's what अब लागिसकेपछि we cannot do, we can only control it. So लाग्नै नदिनलाई त हामीले अहिलेदेखि नै we have to take care of your lifestyle only. So new generation like lifestyle, why lifestyle is so important, they should understand, because it will help you to prevent the chronic diseases like diabetes, cholesterol, hypertension, obesity.
All comes down to the lifestyle.
So अर्को पनि यो मासुको कुरा चाहिँ नि म भनिदिन्छु, because so many people they are fond of eating meat and all. So like diabetic patientले like they can have meat, right? तर जस्तो once a week चाहिँ नि they can have red meat, twice or thrice a week they can have white meat. And fry नगरिकन 2-3 pieces चाहिँ नि they can have it.
They can have it. You can still enjoy masu in Dasai.
Yes, definitely.
You shouldn't be scared of it.
A lot of people. So there's one side of population, and there's another side of population that thinks that अब म औषधि चाहिँ खान्न, लाइफस्टाइलबाट मात्रै डायबिटिज म्यानेज गर्छु भनेर एउटा पपुलेसन हुन्छ नि. त्यस्तो पपुलेसनहरू चाहिँ can they actually manage their diabetes just with lifestyle?
Definitely, especially the young population. Definitely, young population. To so many young population, they come with diabetes. Okay, for them, I don't give them medicine, anything. I don't have medicines for you. For 1 month, you come to me after 1 month. Okay, take care of your diet, exercise. Okay, exercise for 30 to 45 minutes. Do cardiac exercise. Eat healthy diet. Come to me after 1 month. And even though if your diabetes is not controlled, then I will give you medicine.
So even as a practicing physician, you'd rather suggest people to not directly jump onto the medicines.
Definitely not.
Yes.
Definitely not. One small medicine, if it is like one mild medicine, if their sugars are really high, I use only mild medicine for them, and I follow up after 1 month.
I think there is a bigger question that he wanted to ask. Like I would also put an example. फेरि मैले आफ्नै ड्याडको कुरा राख्छु that no, because he has said this हुन्छ नि, since his sugar levels at some time it reached around 250 after he ate postprandial उहाँको नाप्दाखेरि, and then what he did was okay, since it's high, I'll just go upstairs and I'll walk. I'll walk a lot and I'll burn off all the calories and then my sugar levels will come down. Is it a good practice that he did? Instantaneously, impulsively, he wanted to go and exercise for him to reduce the level of sugars. But at sometimes...
So he does that every day?
Not every day, of course.
So what's the use?
Exactly.
So it's like, just right after eating for 10 to 15 minutes, you must take a rest.
True.
And then after 10 to 15 minutes, whatever you want to do, you can do.
Definitely.
Okay, not heavy exercise, but if you want to take a walk, you can do that. That's not a problem. But you should follow that every day, no?
Exactly.
Like once a week, it will not work. And definitely the PP sugar, the postprandial sugar, definitely depends on your quantity of food and depends on your individual's metabolism too.
True.
So people who who are above 45-50 years, we have to see how's their metabolism, because every individuals, they have different metabolism, right?
Yes.
So even though they are taking only one roti, also their PP is sometimes it's on the higher side. So accordingly we have to take, because every individual is different.
Yes, ma'am.
We cannot compare your body to others' body, So every individual is different. Every metabolism is different.
Hence why coming back to your physician and talking to them is very, very vital, because you're different. हजुरले अरूलाई नै सुनेर उहाँले यसरी कन्ट्रोल गर्नुभयो सुनेर हैन, एडभाइस त लिन सक्नुहुन्छ, but at the end of the day you're different. How your body reacts to the food might be different. So it's very, very vital for everybody who is diabetic to actually go and consult to the doctor of what they're eating, how their medications are. Ani ma'am, jumping also to the question, like a lot of people are kind of confused of what type 1 is and what type 2 is. Could you please explain them छोटकरीमा यसलाई चाहिँ?
ओके, टाइप 1 भनेको चाहिँ नि हाम्रो प्यानक्रियास भन्ने जुन ग्रन्थि हुन्छ है, उसले काम गरिरहेको हुँदैन, इन्सुलिन भन्ने हर्मोनै निकाल्दैन टाइप 1 मा। सो हामी सानो भर्खर जन्मेको बच्चादेखि नै देखिन सक्छ त्यो चाहिँ नि है। सो इन्सुलिन भन्ने हर्मोनले चाहिँ नि हाम्रो रगतमा चाहिँ नि सुगरलाई कन्ट्रोल गर्ने गर्छ। सो सानोदेखि नै त्यो प्यानक्रियासले प्रड्युस गरिरहेको हुँदैन, उत्पादन गरिरहेको हुँदैन है। उसलाई चाहिँ नि टाइप 1 डायबिटिज भन्छ। र टाइप 1 डायबिटिक पेसेन्टहरूले चाहिँ नि इन्सुलिन नै लिनुपर्छ, अरू कुनै पनि मुखबाट खाने औषधिहरू छैन। सो टाइप 2 भनेको चाहिँ नि मैले अघि भने जस्तै उनीहरूको इन्सुलिन उत्पादन भइरहेको हुन्छ, प्यानक्रियासले राम्ररी काम गरिरहेको हुन्छ, तर कुनै कारणवश चाहिँ नि त्यो इन्सुलिनले चाहिँ नि शरीरमा सुगरलाई घटाउन सक्दैन है। जस्तो लाइफस्टाइल भयो या इन्सुलिन रेजिस्टेन्स भयो बिकज अफ ओबेसिटी अर सो मेनी अदर फ्याक्टर्स है। उसलाई चाहिँ नि टाइप 2 डायबिटिज भन्छ। र लङ टर्मसम्म कसै कसै केसमा के पनि हुन्छ भने लङ टर्मसम्म टाइप 2 डायबिटिज भयो, 15-20 इयर्ससम्म सुगर कन्ट्रोलमा छैन भने उनीहरू लाइक टाइप 1 डायबिटिजमा पनि कन्भर्ट हुने चान्सेस धेरै हुन्छ। सो अल्टिमेटली उनीहरूलाई इभेन्चुअली भनौँ न उहाँहरूलाई चाहिँ नि इन्सुलिन चाहिँ नि लगाउन पर्ने हुनसक्छ टाइप 2 डायबिटिजहरूले सुगर कन्ट्रोलमा राख्नु भएन भने।
So type 2 can actually turn into type 1 if not properly controlled.
Yes.
So basically type 1 is only cured with insulin, right?
Yes.
You told me earlier about like a lot of people thinking about insulin as a drug that is they get dependent on it and they get addicted to it.
धेरैजनाको नोसन मैले सुन्दाखेरि चाहिँ मेरो when my ठुलो बुवा actually first got diagnosed with type 1 अनि they said that he should start taking insulin by now। अब ढिलो पनि भइसकेको थियो तर अब सुरु गर्नु पर्यो। he is very pessimistic about it and धेरै डर लाग्यो उहाँलाई कि अब मैले चाहिँ डेली मैले सुईबाट हुन्छ नि मैले इन्सुलिन इन्जेक्ट गर्नुपर्छ आफ्नो पेटमा आफ्नो थाइजमा अनि हुन्छ नि नाउ थ्रु आउट माई लाइफ आई विल बी डिपेन्डेन्ट अन इट, आई वोन्ट बी एबल टु इट द फुड्स द्याट आई इन्जोय एन्ड सो मेनी आई थिङ्क देयर वाज मोर अफ अ साइकोलोजिकल एलिमेन्ट टु इट रादर देन हुन्छ नि फिजिकल। He had a kind of a fear that was grown into him. So ma'am, are people actually supposed to be scared or like it's just no, you can live with because we might know we've seen people can live with it. So ma'am, could you advise people that it's livable? It's
very very good question है। अब एक्चुअलीमा के छ भने डायबिटिजको मेडिसिन मैले सुरु गरेँ राइट। मैले एउटा मेडिसिन सुरु गरेँ, पेसेन्टहरू सपोज 6 months 1 year पछि आउनुहुन्छ, मैले मेडिसिन एड गर्छु है। त्यो मेडिसिन्सहरू एडअप भएर गइरहेको छ कि। सो मैले सबै मेडिसिन एड गर्छु, त्यसपछि पनि सुगर कन्ट्रोल भएन भने इन्सुलिनमा जान्छौँ हामी है। अब त्यो मेडिसिन जस्तो नबढाउनको लागि त्यही हो, लाइफस्टाइल इज भेरी इम्पोर्टेन्ट। किनकि जबसम्म पेसेन्टहरूले लाइफस्टाइलमा ध्यान दिनु हुँदैन मेरो कुनै पनि औषधिले छुँदैन। मेडिसिनको डोज बढेको हुन्छ र फाइनली हामीसँग अप्सन के हुन्छ एउटा लास्ट मुटु मृगौला बचाउनको लागि इन्सुलिन, या मेडिसिन खाँदा पनि उहाँको सुगर कन्ट्रोल भएन भने मृगौला बिग्रिन्छ र इन्सुलिन हामीले सुरु गर्नुपर्छ एकपल्ट मृगौला मुटुहरू बिग्रिसकेपछि। सो मेडिसिन नबढाउनको लागि पनि उहाँहरूले इन्सुलिन तपाईँको यो लाइफस्टाइलमा ध्यान दिनु पर्यो मेनली। र कतिपय मान्छेहरू के छ भने मेडिसिन खानुहुन्छ, लाइफस्टाइलमा ध्यान दिनुहुन्छ, औषधि घटेर बन्द भएको पनि छ। सो अर्को हाम्रो मिसकन्सेप्सन के छ भने एकपल्ट मेडिसिन सुगरको मेडिसिन या इन्सुलिन चलाइसकेपछि यो जिन्दगीभर लगाउनु पर्छ भन्ने ठुलो एउटा गलत धारणा छ। त्यो होइन है। तपाईँले औषधि लिएर आफ्नो लाइफस्टाइलमा ध्यान दियो भने तपाईँको औषधि बन्द पनि भएको छ।
It is possible to fight off diabetes. It's
so insulin पनि सबभन्दा त अब इन्सुलिन भनेको अब इट्स इन्जेक्सन, त्यसैले पनि मान्छेहरू एकदम साइकोलोजिकली दे आर भेरी डिस्टर्ब कि इन्सुलिन लाउन पर्यो भन्ने। सो इन्सुलिन भनेको एउटा कुरा म के भन्छु भने घरैमा बसेर गर्ने उपचार हो कि इन्सुलिन भनेको, र 1 or 2 a day हामी दिन्छौँ है। अब केही रिजन हुन्छ होला हामीले दिने त्यसै इन्सुलिन लगाऊ भनेर पहिला हामीले भन्दैनौँ है। सबै चेक गरेपछि उहाँलाई इन्सुलिन चाहिन्छ, उहाँको इन्सुलिन लाएन भने उहाँको कम्प्लिकेसन्सहरू आउँछ भने हामी इन्सुलिन दिन्छौँ है। र इन्सुलिन भनेको तपाईँहरूले घरैमा बसेर पेनमा एकदम इजी छ यसको टेक्निक लगाउने पनि, दुख्दा पनि दुख्दैन। इट्स लाइक हुन्छ नि त्यो मोटो तपाईँको यो रगत निकाल्ने सुई पनि हुँदैन। सो इट्स भेरी सिम्पल मेथड टु इन्जेक्ट होइन। अनि तपाईँहरूले इन्सुलिन लगाउनु भयो, घरैमा लगाउन पाउँछ। पछि तपाईँहरूले लगाउनु भएन, डक्टरको कुरा सुन्नु भएन भने तपाईँको किडनी फेलियर, हार्ट फेलियरहरू, घाउहरू नसुकेपछि त तपाईँको यु वोन्ट बी ह्याभिङ एनी अप्सन्स। तपाईँलाई फ्रिक्वेन्ट हस्पिटल भिजिट गर्नु पऱ्यो होइन, 10 and thousands अफ मेडिसिन्सहरू लिन पऱ्यो। तर इन्सुलिन भनेको तपाईँको एउटा पेनले 2 पल्ट या 1 पल्ट घरैमा बसेर आनन्दले लगाउन सक्छ। सो द्याट्स द थिङ कि दे सुड अन्डरस्ट्यान्ड दिस। किडनी फेलियर भएपछि तपाईँ घरमै बसेर उपचार गर्छु भनेर तपाईँ गर्न पाउनुहुन्छ। सो द्याट्स द थिङ।
Diabetes is a very scary disease.
At the it is in that term, but again,
yeah, if you don't listen to your doctors,
yes, it has a very wide spectrum from being very common disease जस्तो बडा फेरि खतरनाक डिजिज
जस्तो एकदम।
But then again, म्यामले भन्नुभयो जस्तै नै हुन्छ नि, it all leads to how you've been treating it in terms of your lifestyle and the medications you've been taking and how much you're listening to your doctor. त्यतिसम्म हजुरले म्यानेज गर्नु भएको छ भन्दाखेरि इन्सुलिनसँग डराउनु भएको छैन र डक्टरले भनेको सुनिराख्नु भएको छैन, you probably don't have to be as scared as Vinayak right now is. But definitely, ma'am, as you just said, you mentioned there are a lot of things that can happen if you've psychologically blocked yourself of मलाई डायबिटिज छ तर म ट्रिट गर्दिनँ, म आफै अब नेचुरल वेजमा गर्न खोज्छु, म अब सुन्दिनँ होइन, अब उहाँहरूले डक्टरले के भन्नुहुन्छ म बुझ्न नि बुझिनँ, वा आफ्नै तरिकाले कोही गयो अरे त्यो पाथवेमा गयो एन्ड देन he or she had led themselves to हुन्छ नि यो हजुरको किडनी इस्युज हुन्छ नि हार्टमा देखिन थाल्यो भन्दाखेरि what are the most common things that might happen, म्याम, जुन चाहिँ हामीले यो ट्रिट नगरे भन्दाखेरि सबभन्दा कमन चिज चाहिँ सुरुमा देखिने के हो?
ओके, सो टकिङ अबाउट द कम्प्लिकेसन्स होइन, किन कम्प्लिकेसन्स हुन्छ त डायबिटिजको, त्यो कुरा म भन्न चाहन्छु। अब कम्प्लिकेसन्स तपाईँको कति पेसेन्टहरूले के भन्नुहुन्छ भने मेडिसिन्सहरूले किडनी फेलियर गराउँछ, मुटुमा हान्ने गर्छ भनेर देयर इज अ बिग मिसकन्सेप्सन अर्को है। सो दे सुड नो द्याट मेडिसिनले गर्ने होइन है। सुगर डायबिटिज इन इट्सेल्फले नै तपाईँको किडनी र मुटुमा छुने हो या स्ट्रोक हुने हो है। हाम्रो कुनै पनि मेडिसिनले किडनी फेलियर या हार्ट फेलियर गराउँदैन है। तपाईँको 300 सुगर्स छ, त्यही पनि तपाईँले 4वटा औषधि खाइराख्नु भएको छ भने तपाईँको त्यो 4वटा औषधिले किडनी फेलियर गराएको होइन है। 300 सुगर्सले तपाईँको किडनी फेलियर गराएको, त्यो एउटा कुरा है। अब त्यही हो, अब कम्प्लिकेसन्स डेफिनेटली इफ यु डोन्ट कन्ट्रोल your sugars, किडनी फेलियर, हार्ट फेलियर होइन, अनहिलिङ वुन्ड भन्छौँ हामी है, त्यो भयो। आँखामा रेटिनोप्याथी भन्छौँ, आँखाको पर्दाहरू तपाईँको मा सुगरले हान्न सक्छ, इभन ब्लाइन्डनेस हुनसक्छ होइन, स्ट्रोक हुनसक्छ।
These are very common
disease. Very common disease. अब नसाहरूमा छोएर तपाईँको लाइक पेनहरू हुनसक्छ होइन, फिटमा हातहरूमा झमझम गर्ने, पोल्ने, दुख्नेहरू हुनसक्छ। इभन तपाईँको यो सबभन्दा कमनली हामीले क्लिनिकमा देख्ने भने चाहिँ फ्रोजन सोल्डर, हातै उठाउन सकेन भने इट्स अ लङ टर्म कम्प्लिकेसन्स अफ अनकन्ट्रोल्ड डायबिटिज हो कि।
Somebody that has that can't move their hands, so have issues with the ability.
Yeah, my relatives, I've heard of them, like मेरो हात दुख्यो भनेर भन्छ, अब अरू कुनै कारणले हो भनेर उनीहरूले सोचिरहेको हुन्छ, they don't realize it's from diabetes.
That's what, like आफ्नो एउटा रगतमा कुनै प्रब्लम देखिरहेछ, like people come to me with like हुन्छ नि थाइरोइडको प्रब्लम, डायबिटिज अनकन्ट्रोल भएर आउनुहुन्छ। अब उनीहरू चाहिँ नि त्यो डायबिटिज कन्ट्रोलमा र थाइरोइड कन्ट्रोलमा लाग्नुहुन्न, यो हातको के प्रब्लम भएर सोध्नुहुन्छ कि। सो कजलाई वी हेभ टु ट्रिट द कज कि, अन्टिल एन्ड अनलेस यु ट्रिट द कज, तपाईँले हातलाई मात्र उपचार गरेर त भएन नि त।
Those are the symptoms.
Those are the symptoms हैन। सो हात मात्र उपचार गरेर तपाईँको कहिले पनि इट वोन्ट हिल एभर हैन। तर वी हेभ टु तपाईँको आफ्नो यो कजलाई चाहिँ नि तपाईँले निको पार्नु पर्यो।
if you're treating the diabetes, most of your symptoms will go away. For example, we had also come across a lot of people that grow khutama issues or ulcers or open. It's quite difficult for people. There's also, ma'am, your dermatology ma pani chala sambandhi rogharu pani huna sakcha. Like a lot of people ask like say acne or like warts haru bhayeko yस्तोहरू पनि हुन्छ.
वेल सबैभन्दा कमनली चाहिँ नि चिलाउने भने इचिङ भनेर आउनुहुन्छ हैन आफ्नो आफ्नो लाइक हैन प्राइभेट पार्ट्सहरुमा धेरै इचिङ भयो हैन तपाईको स्किनमा इचिङहरु भयो हैन लाइक अब जस्तो हामीले टाइप 1 डायबिटिजहरुमा सो इट्स अटो इम्युन डिजिज भन्छौं टाइप 1 डायबिटिजलाई हैन सो अरु रिलेटेड अटो इम्युन स्किनको पनि अटो इम्युन डिजिजहरु हुन सक्छ सो यु नो तपाईको साइड बाइ साइड यस्तो यो स्किनको कम्प्लिकेसन्सहरु पनि हुन सक्छ अब डायबिटिज कन्ट्रोल भएन भने नट ओन्ली तपाईको किडनी या मुटु तपाईको हरेक पार्ट अफ your बडी एनी पार्ट छालादेखि लिएर आँखादेखि लिएर नाकदेखि लिएर कानदेखि लिएर तपाईको प्राइभेट पार्ट्स जेमा पनि कम्प्लिकेसन्सहरु हुन सक्छ
because it's something that is in your blood.
In your blood.
In your
so
blood. Yeah, it goes everywhere.
Blood runs
everywhere
throughout your body.
All organs.
So yeah. So that's the thing.
This is very vital. When people say maybe chala sambandhi ho bhane हैन डाइरेक्टली दे अगेन सिम्पटमको पछाडि भागेर हुन्छ नि मलाई यो मात्रै ठिक पार्नु छ बट देन अगेन इफ यु गो यसको सुगर बढाएर छ हुन्छ नि बिहाइन्ड द सीन देयर इज समथिङ एल्स गोइङ अन द कज इज डिफरेन्ट देयर इज अल्सो you said like issues that are like ophthalmic issues ma'amle bhannubo retinopathy.
A lot of people retinopathy ma most of them they just think budeskal ho mero आँखा यस्तै हुँदैछ भनेर छोड्दिन्छ के they don't go for ophthalmic examinations or how often do you think people should get screened in ophthalmic for retinopathies हरू भनेर
well अब जस्तो टाइप 2 डायबिटिक पेशेन्टले चाहिँ नि राइट आफ्टर दे आर डायग्नोज राइट हामीले आँखाको एक्जामिनेसन उहाँहरूलाई गराउनै पर्छ र देयर इज अ स्पेशल टेस्ट कल फन्डोस्कोपी हैन सो फन्डोस्कोपी भनेको रेटिना हेर्ने चाहिँ नि हामीले त्यो चाहिँ नि गराउनै पर्छ उहाँलाई आँखामा छोको छैन किनकि फर्स्ट कम्प्लिकेसन्स देख्ने नै तपाईको आँखामा हो कि सो त्यो हामीले डायबिटिक डायग्नोज गर्ने बित्तिकै उहाँहरूलाई आई एक्जामिनेसनको लागि पठाउनु पर्छ
As I've heard so many things and we've come up with so many symptoms that might lead, ma'am, why do you think it is something like this which is curable and which is curable but not manageable, let's say, how has it become हुन्छ नि in a sense कि यो एक किसिमले epidemic को जुन भइरहेछ नि in America now the stats are like अब आउँदो सालहरुमा every one person in third is going to be diabetic or like
pre-diabetic
80 million around 80 million people are going to be pre-diabetic. That's a huge number and it's quite scary हुन्छ नि as of our generation we'll be like मलाई त थियो now I'm predisposed to have diabetes. Why do you think it took like such a big leap, like exponential?
I think it's all because of digitalization. Because I have, like, when I was, 12, 13 years old, I've heard at that time, the world will be in your hand. True. After 10, 15 years. You might have heard about it. So it is in our hand only.
As of today, yes.
Right? So this really, like, everything we can do sitting on your computer.
True.
Right? So we don't walk, we don't have physical activities. Previously, तपाईको हुन्छ नि अब फेसिलिटिजहरु पनि धेरै भयो हैन हामी हिन्न पनि कम गर्छौं है बसेर 10 12 आवर्स हामी काम गर्छौं that's the thing कि त्यसैले डायबिटिज भनेको इट्स सो कमन दिस डेज खायो जंक फुडहरु खायो नो एक्सरसाइज नो वकिङ सो यो कारणले डिजिटलाइजेसनले पनि मेन कारण हो तपाईको भएको अर्को चाहिँ नि मेबी लाइक एन्भाइरोन्मेन्टल टक्सिन्स because a lot of factories are coming up हैन so environmental toxins ले पनि यो डायबिटिजहरु थाइरोइडहरुलाई पनि तपाईको अलिकति बढाइराको जस्तो पनि लाग्छ मलाई
Is there ma'am I think like putting it like summing it up also हुन्छ नि अनि also putting a short aspect of something that I think is not often talked about is just the psychological effect हरुको बारेमा कुरा गर्यौं. There's a term called diabetic burnout हुन्छ नि a lot of people face the kind of feeling that मैले जति गर्दा पनि हुन्छ नि कन्ट्रोल भइरा छैन or like I'm not being able to eat like now अब के गर्ने हुन्छ नि यति मैले कन्ट्रोल गरेछ त्यही पनि That if in case it actually turns into a psychological thing, or if they actually need a therapy session to go to a psychologist and maybe talk about हुन्छ नि how उहाँहरूको eating disorder भयो कि त्यो कारणले वा अलिक काममा त्यसलाई issue बनायो कि is it okay for people to reach out for like if they have issues with their mental health because of diabetes?
Definitely, you know, when patient come to me, especially the young patient, when they come to me, I make sure I make them feel that diabetes is not a big disease. I know counseling is so important.
True, exactly.
होइन एउटा पेसेन्ट आउनुहुन्छ आफ्नो प्रब्लम लिएर आउनुहुन्छ भने डायबिटिजको प्रब्लम इट्स अ बिग थिङ कति ठुलो रोग भनेर आउनुहुन्छ कि सो उहाँलाई चाहिँ नि तपाईँले लाइक अलिकति कम्फर्टेबल बनाइदियो भने चाहिँ नि उहाँको जुन साइकोलोजिकल प्रब्लम्सहरू चाहिँ नि त्यो बढ्नलाई रोकिन्छ है र एउटा 1 सेसन अर 2 सेसन्स अफ साइकोलोजिस्टहरूका पनि उहाँलाई पठाइदिए केही पनि प्रब्लम त हुँदैन है तर वेन पेसेन्ट कम टु यु फर्स्ट टु डायबिटिजको एन्डोक्राइनोलोजिस्ट कहाँ जब आउनुहुन्छ यो टकिङ टु यर पेसेन्ट इज सो इम्पोर्टेन्ट राइटिङ मेडिसिन इज नट द्याट इम्पोर्टेन्ट द टकिङ अ पेसेन्ट टकिङ टु यर पेसेन्ट काउन्सिलिङ अ पेसेन्ट इज सो भेरी इम्पोर्टेन्ट तपाईले बोल्दामै उसको आदि रोगहरू जान्छ के
एक्ज्याक्टली एज अ we've heard a lot from patients yes उहाँ डाक्टरसित त बोल्दैखेरि
that's so true that is very true so उहाँहरूले आदि आफ्नो रोगै बिर्सेर खुसी भएर जानुहुन्छ साइकोलोजिस्टको त उहाँको दिमागमा पनि आउँदैन so you are the endocrinologist are the psychologist as well
you have to do both of
them
yes following up with that ma'am ani एउटा अझै issue what I feel like has been happening is a lot of people when they find out कि अब ल मलाई diabetes भयो वा they've gone through it for several years but sometimes because भनौँ न उहाँहरूको family members जो नजिकमा हुनुहुन्छ for example your husband your wife if they're not as supportive towards you like they don't show as much of care के त्यसले पनि एग्रेभेट गर्न सक्छ यो चिजलाई डायबिटिजलाई अफ कोर्स आई थिङ्क इट इज अ भेरी सिम्पल क्वेसन द्याट इट सुड यदि केयर गरेन भने बट देन अगेन हाउ डु यु थिङ्क फ्यामिली प्लेज the role for like caretakers for such patients?
This is a very important question है पेसेन्ट फ्यामिली जस्तो हामी कहाँ आउनुहुन्छ है हामी उहाँलाई टाइम दिन सक्ने भनेको 10 to 15 मिनट्स मात्र हो भनौँ म्याक्सिमम् 20 मिनट्स हामी डक्टर्सहरूसँग कुरा गर्नुहुन्छ तर म्याक्सिमम् टाइम त उहाँहरू फ्यामिलीसँगै हुन्छ नि होइन सो यहाँ चाहिँ नि फ्यामिली प्लेज अ एकदमै भाइटल रोल के है कुनै डायबेटिक पेसेन्ट छ भने अब भनौँ न हस्बेन्डलाई डायबिटिज भएको छ र वाइफहरूले यो खाने यो नखाने एकदम खानामा रिस्ट्रिक्सन्सहरू गर्नुभयो भने त्यो साइकोलोजिकली नै उहाँको त्यो डायबिटिज कन्ट्रोल हुन दिँदैन कि स्ट्रेसले होइन मैले अघि भने जस्तै सबै कुरा खानुहोस् मिलाएर दिनुहोस् त्यो होइन त्यो हस्बेन्डले पनि आफ्नो वाइफलाई सपोर्ट गर्नुपर्छ मदर फादरले पनि आफ्नो हुन्छ नि बच्चाहरूलाई सपोर्ट गर्नुपर्छ होइन फ्यामिली प्लेज अ भेरी इम्पोर्टेन्ट रोल के यसमा होइन खानादेखि लिएर त जुन बेला पनि नाक मात्र गरिराख्यो यो नखाऊ स्पेसली लाइक हाम्रो एल्डरली पेसेन्टहरू जस्तो 70-80 इयर्सको पेसेन्टहरू आउनुहुन्छ राइट अब उहाँहरूलाई डायबिटिज छ अब 80 इयर्सको पेसेन्टलाई हामीहरू बच्चाहरूले उहाँलाई यो खाऊ यो नखाऊ भनेर रिस्ट्रिक्सन गऱ्यो भने त उहाँहरू कहिले पनि निको हुनु हुँदैन बिकज 80 इयर्ससम्म एउटा उहाँको एउटा रुटिनमा गइरहेको हुन्छ उहाँहरूले सो 80 इयर्सको पेसेन्टहरूलाई उहाँहरूले त्यो एजमा खाएको नै ठुलो कुरा हो होइन दे मेच्योर इनफ टु नो अब मलाई रोग लागेछ मैले के खान हुन्छ र के खानु हुँदैन र कति मात्रामा खानु हुन्छ भनेर
You must have that kind of respect when you're talking to the age ko patients.
And so families and family environment is very important ki diabetes patient especially.
You were sharing your incident, ma'am, the husband wife in the OPD room. What had happened?
Yeah, the husband has diabetes and the wife is like shouting at him in front of me and you're taking this, you're drinking alcohol, you're smoking and all in front of me. It's like the wife is so frustrated.
True.
Okay, so definitely the husband should also like understand the feelings of his wife, and wife should also understand the feeling.
True.
So so a family is very important.
Yeah. Instead of making diabetes a blame game, the family should support each other and cure them.
Definitely. Should
Come
understand
together.
understanding is so important.
यही बुदामा आउँदाखेरि म्याम मैले ठ्याक्क भन्नुभयो त्यो you smoke होइन यो एलिगेसन्सहरू आउँछ even when you're in the family. For example, for any working adult as of now, as I've seen in Kathmandu, probably a lot of our viewers might even find it relevant कि it's quite common now, हुन्छ नि, it's now fashionable to just go and have a bottle of beer, हुन्छ नि, maybe have drinks with your friends. पहिला पनि थियो, आज पनि छ, जति पनि डक्टरले भन्नु हुँदाखेरि पनि people are still reluctant, हुन्छ नि, and then still finding ways to drink alcohol, to smoke, हुन्छ नि. How strict are you with your patients when it comes to this? How do you feel like, of course, in terms of lifestyle, people will ultimately go and drink and smoke. It's more of a, it's an addictive thing. It's more of a social thing. So how do you deal with this? Like, let's say, kuni patients, of course, you have to like bar them. But at the same time, like, how strict are you with this?
So regarding alcohol, okay, like I said, food also you should have in control, like a disciplined manner. Alcohol also, like according to studies, like you can take like moderate amount of alcohol every day, like 30 ml you can take per day. It will, like study says, it cleans up your blood.
Okay.
Blood circulation makes your blood circulation good. But only 30 ml of hard drink and 350 ml of what do you say, beer or wine. That's it. But if patient is alcoholic, then I'm not supposed to say that,
True.
If I say that 30 ml is okay for him, like 300 ml
is okay.
Yeah,
So-
as a doctor, you cannot just
So
promote.
occasionally, yes, you can drink, but definitely in a disciplined way. Limitation should be there.
Again, you have
Okay.
to check yourself before like going out for the drink. Or you can't expect to go and have alcohol once your sugar is 300 or above. हुन्छ नि.
Definitely not, and the snacks. With
Yes,
snacks,
yes,
snacks is the
snacks.
main thing. Is also the thing, because either you are having fried food or you're having salad with snack.
True.
That also matters.
Definitely overeating and then using snacks as हुन्छ नि, हामीहरूले whenever we go out on drinking, having those extra calories, and you don't expect, like a lot of people, ma'am, कतिजनालाई थाहा पनि रहेनछ कि even it came as to a surprise to a lot of people. Alcohol has immense amount of calories. It's kind of like an extra macronutrient in itself,
Itself,
होइन?
Yes,
तर
yes.
त्यो बुझ्नु भएको छैन. Is it like, could you just tell them like it's very true, like alcohol itself is like झ्यापै हजुरको body
Definitely, it contains lot of calorie, and it's written in the bottle as well.
Exactly.
It contains this much calorie.
True.
Right? So if we are going to have alcohol today, it's better not to have a lot of carbohydrate. Better have it with salad or some like good snacks. So in itself, you can read in the bottle. It's already written there how much calorie it contains.
True, definitely, ma'am. Okay, I think
We had a really wonderful
wonderful
conversation.
time. Summing it up, ma'am, could you also like, just for the viewers, for one last time, if you'd say something, okay, for diabetes, these are the 3 things you can do. Could you like please say something to the camera?
So diabetes is a preventable disease. Okay, if you don't want to invite diabetes, please take care of your food, exercise, and your stress. Okay, it's not easy. Everyone must follow this. Every human being must follow these 3 things. Not only for diabetes, for other diseases, chronic diseases like cholesterol, like pressure, obesity, and even for heart problems. It's very important. Take care of these 3 things in your life. Thank you.
Thank you so much, man.
Thank you so much, ma'am, for your time. It was amazing talking to you. This was a privilege for us
Yes.
as NepClinic. We really wanted to discuss on diabetes, and you were the best we could come across. And please, if you guys want to get a consultation from ma'am Norvic ma hununcha, Norvic Hospital in Thapathali. She's there. You guys can have any issues regarding diabetes or other such similar endocrinological issues. You can go to ma'am. Thank you so much, ma'am, once
Thank
again
you so
for
much
having.
for having me here. Thank you so much.
Thank you so much. Ani Vinayak, we have something.
Oh, yes.
Oh, what
we
is
do.
It's a small
So basically,
token of,
for our
appreciation.
chini doctor,
Oh
we have
my
a small
God.
token of
So
love.
if this is a dark chocolate, you can take one piece a day.
Exactly.
Every day, one slice.
Slice.
Yeah.
So just a very small.
Thank you
token.
so much.
I found it quite ironic, like chini
Throat
विशेषज्ञलाई हामीहरूले chocolate खुवायौँ
Yeah, if it was not a dark chocolate, I wouldn't have accepted.
Exactly.
Yes.
So dark chocolate is good, guys. Right? Just one piece a day.
Yeah.
Thank you so much, ma'am. Once
Thank you.
again, it was pleasure having you here. And now, with this, we'd like to end
the
our first
podcast.
episode.
So
Right?
yeah, keep following for more of this amazing content.
And ciao, bye bye. Take care. Thank you. Okay, let's take a final